We measured a patient's tear film to determine the osmolarity of that tear film. And what that means is we're trying to determine the concentration of tear particles within the film. Why is that important? It's important because if the concentration is too high, it means you have a dry eye. And the consequence of a dry eye is an epithelium, which means the skin on the surface of the eye, which becomes irregular and rough. And because it is irregular and rough, your vision is going to have distortion. This is particularly important when we do cataract surgery on a patient or when we do LASIK surgery on a patient. In those cases where we are temporarily disrupting the tear film by the surgery, the outcome is going to be very dependent on a good tear film afterwards. For that reason, we pre-treat all of our cataract patients and our LASIK patients to build up their tear film to be normal prior to the surgery. That way we'll get a better surgical outcome day one. Now we're going to measure your tears in order to determine whether or not a deficiency in tear is causing the symptoms that you're having. I'd like to have you tilt your head a little bit towards the right, look up towards the light. That's perfect. Now Mary is going to take this instrument and just touch it towards the edge of your lid, and this is going to get a sample of your tear. Just like that. Perfect. Now what Mary has done is taken a sample of your tear, placed it into the tear lab measuring device, and this device is really unique because in minutes it can tell us what the concentration of your tear is. And we see in looking at the machine that the concentration measures 356 milliosmoles. That is very high. The fact that it is as high as it is means that you have severe dry eye, and that explains the symptoms that you're having. And without going further, we know that we need to address that dry eye with different kinds of tears than ones that you may have been using.